breakthrough from the CDC has identified vitamin E acetate as the potential culprit behind vaping-related illnesses in the U.S. While looking into these illnesses, health officials have found nearly 2,300 cases in 49 states. 95 of those cases are in Wisconsin, and more are under investigation.
Tonight, Andrew Merica is digging deeper into the work happening in Wisconsin and what this breakthrough means for the investigation.
From the beginning,
I feel like we've made a big contribution.
These scientists have been on the front lines of a health crisis, illnesses related to vaping.
Wisconsin has been one of the major states in helping provide the samples and making the determinations that have moved the investigation forward.
Noel Stanton is the chemical response coordinator at the Wisconsin State Laboratory of Hygiene. His lab has been working around the clock since the first 8 hospitalizations in Milwaukee.
Initially, it was to gather information related to the cases, to try to determine that vaping was the common link in them.
All of the samples in Wisconsin passed through this lab, the first in the country to analyze vaping, with a team of half a dozen working since this summer.
That's been extremely difficult because not only were the samples from patients very limited, but the variety of products that the patients have used made it more than looking for a needle in a haystack. It was looking at multiple haystacks to find the right needle.
But now, a potential needle.
The consistency of that finding, coupled with the fact that it was right at the point where the damage is occurring, that's pretty powerful evidence.
Vitamin E acetate is a chemical that scientists say is usually safe and is common in hand creams and even taken orally.
The key here is that people don't inhale vitamin E acetate.
And when you inhale vitamin E acetate, we don't know what the effects can be.
Dr. John Mayman previously worked in Sierra Leone with the CDC during the Ebola outbreak. He's now a chief medical officer with the Wisconsin Department of Health Services.
It's my group here in the Department of Health Services that helped launch the public health investigation here in Wisconsin.
Dr. Mayman says scientists have never studied vitamin E acetate in the lungs, and no one knows exactly what harm it's been doing in vaping liquids.
I feel like we're getting closer. There needs to be some basic science done to better understand the effects of vitamin E acetate when it's inhaled. And at the same time, we need to also make sure that we're not missing any other contaminants in these products that could also be causing this.
The CDC found vitamin E acetate in all fluid samples from sick people's lungs, including samples from Wisconsin. Scientists believe it was added to the vaping liquids to help thicken them.
And I understand anecdotally that it also makes a good cloud, which seems to be an important component of vaping.
Major vaping manufacturers say they don't use vitamin E acetate in their products.
That really highlights the risk of these, which is when you get these cartridges off the street or from your friends, you really don't know what's in it.
And I think the lesson here is that if you use unregulated products, you're taking a risk.
For now, the work of this lab and labs across the country continue as scientists work toward a definitive end to the epidemic.
If it is determined that it is the vitamin E acetate, the work of the lab may be done. And the goal will be to remove that from products and make sure that the public knows that.
In Madison, Andrew Merica, 27 News.
THC was also identified by the CDC in 82% of the fluid samples from sick people's lungs, which means nearly 1 in 5 samples did not contain THC.
The CDC says compounds commonly found in other THC products were not identified as chemicals of concern in vaping lung samples.